Hey everyone, welcome to Private Practice Matters. This is a new podcast that I'm starting to talk to private practice owners about the practice of medicine and private practice in particular. I said it's a new podcast and it's actually not a new podcast. Many years ago, I had this exact same podcast. I should look it up and see if it's on YouTube. But as I was leaving my old practice and starting my brand new private practice about 5 years ago, I had to put all my old content on a shelf. And I'm finally at the point now where I want to get back and talk with other private practice owners, talk about my practice, talk about the way that private practice is going now, and share and hear from private practice owners about why their private practice matters and why we should keep trying to stay and grow private practice. The format for these episodes is going to be a couple of different things. We'll do interviews from time to time with other experts and people that can contribute and think of different ways or are solving for private practice in a variety of different ways. In general, we'll start with an article that's trending and going around about the private practice of medicine and private practice healthcare in our country. And then we will do a deep dive. And then, so we'll go into a little bit more depth there, a little bit more teaching, a little bit more of how things are done or what sorts of things to think about as a private practice owner. And then we'll do a little bit of question and answer. And so for today, I have 3 different things that we're going to talk about. I'm going to try and keep to my format, at least for the very first episode. So the first thing that we're going to do is talk through an article that was in Medical Economics that talks about online reviews and how patients are finding their clinicians in 2026. And it was a recent article that really kind of got into the weeds with over 1,000 people of how are you actually finding your doctor. And I think you'll be interested to see a couple of the things that stood out and also that are very practical for busy practice owners to implement. The second section, the deep dive, will be about scribes. And I'm excited to share with you my long journey of having scribes in my practice and why you need a scribe. There's no like consider a scribe or perhaps get a scribe, or there's no hedging here. This is you need a scribe. And then in the last section, we're going to talk through a question that came in from a colleague about how to stand out in medicine in 2026, because there are so many different voices out there, and how to really stand out and own your approach and own your expertise. This is something that I love talking about. I've talked on a lot of stages about this, and I'm excited to get to talk through the specifics of how to actually stand out with all of the voices and all the misinformation and disinformation. So hopefully this interests you and you keep listening. If you have questions as we go, simply click on the show notes and there's an ask comment question box there where you can submit your own comments, your own questions. After the music, we'll get started talking through the first article. Okay, so in today's article that we're going to go through, this is from Medical Economics, which is one of my favorite journals to learn and see what's going on in the world of private practice. This is an article that is titled, it's from August of 2026, and it's How AI, Online Reviews, and Rising Standards Are Redrawing the Path to Care. There was a couple striking things that really stood out to me in this article, where they surveyed over 1,000 patients and looked at trends and preferences and those sorts of things. One of the things that was most striking to me is the star reviews. I certainly shop on Amazon, as we all do. And anytime you go in there, you're looking for something with a good star review. And if it doesn't have a good star review, then it's going to take a really strong, specific reason. If it's 3 stars or 2 stars, what reason would you have for purchasing that when there's so many different options out there? If there's a 4.5 star toaster and a 2-star toaster, what would be the reason that anyone would ever pick the 2-star toaster? And although we as clinicians shouldn't be judged to the same degree in the star rating as a toaster, that is what patients are doing when they are going online and looking and trying to figure out who they should go to for the specific problem that they're facing. And who can blame them? Because we've been trained to look for those star reviews. I like to read. I find a new book that looks interesting. The first thing I do is go to Goodreads and see if it has at least 4 stars. And if it doesn't, then I'm going to have to really figure out a justification for why I would choose that sort of one. And so what this study looked at and found was that 75% of patients won't book with a clinician rated below 4 stars, which feels very unfair to clinicians who have very little control over their Google reviews, but this is a way that patients are making those decisions. And this is something that we can't control what an individual patient says. If they hate us, they're going to leave a review. If they had a bad experience, if we send them a bill that they didn't like, there could be a million different reasons that they leave a 1-star review. But we can control asking and getting more positive reviews from patients that we want to leave a review. And one of the things that I learned so this was my very first rotation as a third-year medical student, was on surgery. It was surg-onc. And we were doing this procedure where you basically fill the patient's belly with chemotherapy and then you move it around. And they called it the shake and bake. I don't remember the specifics any more than we had to shake the patient for a while. And then the attending was like, well, how are we going to get all this out? And the surgery resident wasn't really pimping me, but was kind of just quizzing me of, well, what's the solution to pollution? Dilution. So dilution is the solution to pollution. So long story short, if you were having a lot of negative reviews, the solution to the pollution isn't to try and get them taken down, because you can spend hours and days trying to get those reviews taken down. You won't get them taken down, no matter if they're flagrantly false or anything along those lines. The solution to pollution is dilution, meaning dilute out those negative reviews with a lot of good reviews. You shouldn't expect, and it would be unusual if you went and looked up a physician or a toaster or whatever it was, and it had 5.0 stars, 500 reviews, 5.0 stars. Somebody's had a less than 5-star experience. And if you saw 5.0 stars times 500 reviews, you think, well, they are deleting bad reviews, or they're doing something to stack the deck in their favor, and I'm not going to trust that either. But we should all be able to easily, with all of the patients that we get to take care of, get to that 4-star or better reviews. And this study supported that, like 75% of patients won't book if they look you up and you have less than 4 stars. The other thing that they found was that 55% of patients had canceled or avoided booking because of online reviews. So they're looking at those reviews, and that is impacting their choice. This always doesn't bother me, but it hangs me up, because I'm thinking about most patients reach out when they need something. And if they're spending all this time reading the online reviews and those sorts of things, then it is keeping them from getting the care that they need. And it's very likely that if they're doing it on their phone, they're going to get a notification, they're going to get a text message, they're going to get distracted, and then they're not going to book. So it's incumbent upon us to make it really easy to get those patients to actually book, because there are so many different attention that can keep them from actually booking. Now, one thing that they did say really helped, 66% said a clinician responding to reviews changes how much they trust them. And so when you look on Google, when you look on Yelp, when you look on those other places, you can reply back to reviews that come in. And what was found is that improves the patient's likelihood of booking if you're replying back. Now, you as the busy clinician, practice owner, are not going to be replying back, but your staff, or actually there are a bunch of automated services that you can use that can say, okay, this was a positive review. Thank you so much. We really appreciate being involved in your care, blah, 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 blah. If it shows that there's an active thing going on, that actually helps. So if your reviews are sub where you like them to be, if they're a little bit subpar because of all the different factors that are way outside your control, then responding back to reviews or setting up an autoresponder, those things exist. Those can respond to those reviews so that it's not obviously giving any HIPAA information away, but just the fact that you've acknowledged the review actually improves your standing in the eyes of the people that are looking for you. Now, the one thing that was really stood out here that they mentioned specifically is the use of AI when looking for a clinician. And I think this has snuck up on a lot of us, is 47% used a tool like ChatGPT or Google AI or Claude to research a clinician before booking, which was way up. It was 31% just 9 months ago. So that is becoming a way that people are looking up and finding their clinician beforehand. And I actually did this yesterday on my phone. If you're watching on YouTube or on Substack, you can see, but I actually looked up just pediatrician in Lincoln, Nebraska, because I wanted to see what happened. And I was pleasantly surprised, because I don't know that we've done much intentional to get in front of our requests and those sorts of things. But what you'll see on this is first one, focus, come on. There we go. If you're looking for a pediatrician in Lincoln, Nebraska, I'd put these at the top of your list. And it had Frontier Pediatric Care, my practice, which was nice and surprising. And I honestly will be sharing in the coming weeks and months how to get yourself found on those AI platforms, because that is where people are looking to find out the skinny about you before they ever even book the appointment. So it's important for us to show up there, and it doesn't have to be hard and it doesn't have to take lots of time, but it is something that is important enough to do. So now, when it comes to those reviews, there are a couple of things that this study really looked into and highlighted when it came to the reasons that patients turn away in a review. Now, they are what you would expect when it comes to review. It wasn't the outdated facilities. Only 11% would change their mind because of outdated facilities. It wasn't even scheduling difficulties, which are a big hassle for a lot of people. That was 20%. The top things that turn people away are rude or unhelpful staff, which has nothing to do with you as the clinician, but it is your staff that are rude or unhelpful, and they make patients turn away. The other one is doctor didn't listen. And I actually, in a couple of weeks, have a podcast queued up talking about how to make patients feel heard and understood better. And I actually went back and read some articles from the Lancet from the 70s that talked a lot about empathy and reassurance. The number 1 and 2 reasons that patients turn away because of a review is seeing and hearing that the doctor didn't listen to them, or that their staff were rude or unhelpful. Those two are things that are very much under our control and our ability to make patients feel heard, understood, and supported in their journey by working on ourselves and on our staff to do those sorts of things. Those were more, even than long wait times, even in billing issues or those sorts of things, those two stood out. So if we're going to focus on how can we make sure that our Google reviews represent us well, it's making sure that people are leaving positive reviews saying that I felt listened, I felt heard, I felt understood, and the staff were helpful. Those are the things that are going to protect you. Those are the things that are going to be the solution to the pollution that sometimes shows up in our Google reviews. So when they talked about those negative reviews, one thing that the article said is that a negative review answered with care and accountability often does more for prospective patient trust than the negative content itself takes away. Responses are also read by AI tools when they summarize a practice. And so the two important things to take away from there are, if you have a negative review, quit wasting your time trying to get it taken down, whether it's fair or not or anything like that. But if you can answer it with care and accountability, that does more for prospective patients than the negative comment itself. And AI, Google, is scraping those comments and those replies when it's creating that summary about your practice and what you do that shows up in Google, that shows up in chat, all those different places. So responding to reviews only helps, whether or not it was a good review or not, to make it look like you care and that you're involved and you're engaged. And so I would consider and encourage you to hop onto your Google reviews and see what people have written recently. And when possible, reply as your business. Thank you for leaving such a review. We love taking care of families like yours. Something along those lines that is obviously doesn't break HIPAA, but also acknowledges that we like taking care of families like yours for leaving good reviews. The last thing that this article talked about is really the patient, the prospect to patient journey, which is something that I've talked a lot about in marketing and practice marketing. They highlighted this as well, is that it kind of goes through about 5 stages. The first is awareness, being even aware that this practice is an option or something that fits the needs and solves problems for specific people, specific problems. The second is research. And then the third is decision. And then we have our experience, and then the engagement that follows after that. So it goes awareness, research, decision, was this the right practice for me to book at, or should I keep looking? And then the experience of being seen in that office, and then the engagement. And the engagement really focuses on, would I send family there? Would I leave a positive review? Would I go back? And those sorts of things. So as we're mapping out, and over the next episodes, I love talking about practice marketing and really the prospect to patient journey of how people first hear about you and how they end up booking an appointment with you and then telling their friends and going back and continuing to get your help. That's something that I really am passionate about, is teaching that to private practice owners, because it's very important. And when we think that through, there's different things we can do at each stage. But those are parts of the practice experience that we have control over when it comes to how patients become aware of us, where and what they do and find when they research us, and then helping them to make that decision, removing objections, making sure that their questions are answered easily. And then they get to us and we're able to provide for that experience all before they walk in the door. They've kind of made up their mind about what is my perception of this practice based on the different things that they find in their research. They have the experience, and then from there, we're able to engage with them and get them to help bring more patients to us. So after the music, what we're going to do is we're going to jump into the deep dive where we talk specifically about scribes. And we're going to talk about why you need, not you should consider, why you need and deserve a scribe. All right, I want to talk today in our deep dive about scribes. Now, I'm going to go way back. I was the wellness committee member for our local hospital system for a spell a couple of years before COVID. And one of the things I got sent, thankfully, to some physician wellness and things, and it was kind of just like an up and coming thing at that point. It wasn't the way it is now where it's discussed and there's lots of committees and we've moved beyond just like, let's have some yoga over your lunch break sort of thing. But one of the things that they talked about there is documentation and what a burden it is for physicians to keep up on documentation. And they were talking about different things to do, and one of them was scribes. This was way back when, but way before AI, like nobody even knew what AI was. If you said ChatGPT, they would just look like you as if you were speaking Latin. But one of the things that they talked about was scribes. And I said, this sounds amazing because I'm seeing 20, 30 patients per day and my notes are mostly templated, but then it takes time to type out all the stuff. It's stretching into the evenings. It's impacting my willingness to add on another patient because yes, I could see them quickly, check their ears. Yes, I could see them quickly, even like put a staple in their head, but the documentation is going to be such a hassle. I piloted in our practice a scribe program. And back then, what we would do is we would reach out to the local university and say, hey, we have the scribe program. The ideal person for a scribe is somebody that is graduating but didn't match or didn't get into medical school, so they have a gap year. We would have these gap year students come into our practice and play scribe. And it was great. I had 3 scribes this way before I left and started my own practice, and each one of them was with me for 1 to 3 years. They all had a little computer on wheels. They had a laptop and they had a little thing, and they came into the room behind me and listened to the visits, and they got such a good clinical experience out of it. I really feel bad that kind of scribes has morphed so much now and they're not getting those clinical experiences anymore, because my first scribe that was with me, Grant, he was with me for 3 years. He saw like way over 12,000 patient visits, and I wouldn't have even told the parents what we're going to do, and I would already hear him clicking and typing in if it's an ear infection, I'm sending an antibiotic. Or one time he came out of the room and he's like, do you think that kid is autistic? And I was like, yes, I haven't brought that up to the parents yet, but I'm suspicious of that, because they would get such a great clinical experience. And so I had a scribe, and it was a complete game changer for me, because I went from having to write down everything in the note or try and, talk to the patient and then document when the fever started or when the abdominal pain started or whatever. There would be things that would get missed if I didn't document that. And then I would have to go back and I had to put in all the orders and everything along those lines. So it was a huge, complete game changer when I started the scribe program for myself in my old practice. It was a lovely clinical experience. All 3 of the pre-med students went on to medical school, and then they're like in residency or graduated now. It makes me feel old, but that was such a great experience. And so what now private practice owners should all be doing is having if nothing else, an AI scribe that's catching your documentation and keeping you from being constantly distracted on your computer during visits when patients are wanting and expecting you to look them in the face and make them feel heard and understood, and keeping you from spending your evenings catching up on documentation that mostly no one is ever going to look at in the entire history of humanity. Yes, sometimes we're sending notes to a referring clinician. Yes, sometimes we're referring back to our notes, but by and large, a lot of those visits, maybe one little line from that will ever get looked at again in all of human history. And yet we're spending minutes and hours charting to get all of that done, and there's just no good reason for it anymore. There are so many great scribe softwares out there now that are completely free. Now, we have one that's integrated into our EMR that is not free, but it puts everything into each little box. So I can call out 47 pounds and it'll put it into 47 pounds. I can call out bulging right tympanic membrane and it'll put it in the ENT field, and then it will also add acute right otitis media into the assessment. But there are so many great tools out there. Open Evidence, Heidi, Freed. I don't want to specifically name any or miss any, but there are so many good options out there that will start collecting the information during the visit so that you have that, and then you're able to, instead of typing it all out or trying to remember what so-and-so said or what day the fever started or if they took their medicine recently or anything along those lines, it will capture all of that for you, and it will save you so much documentation time. What happens when you do that is it frees you up to look at the patient more in the eye, and the room and to enjoy thinking about medicine again, rather than just kind of constantly being distracted and documenting. You're able, what I typically do, when I go in to do a visit, say it's a new ADHD evaluation, I do a lot of ADHD visits. What I'll do is I'll have my scribe on the computer, and then I take notes on my iPad so that I can not forget everything that's being said, but I don't have to worry about catching every little thing. And so what that looks like is basically I just take these notes as I go, and it gives me all the things that I'm wondering about. It gives me the assessment that I'm coming up with. It gives me the pieces of the plan that I'm putting together so that I have all of that and can reference that back while I'm talking to the patients. But I love being able to write that down, but not have this be my note at the end of the day. This does go into the chart, and I do look at this because it helps me to jog my memory really quickly. But I also capture the documentation both for legal reasons, both for historical accuracy reasons, but it also helps me to justify the billing level that you're billing to when you capture all that information. Now, there's two things that often trip people up when it comes to using a scribe. The first is that it's not perfect and it won't capture everything perfectly, because we as physicians have been trained to be type A perfectionists. And if it misspells something, or it puts something in the wrong spot, or it's not in the right order, or if it says that the patient represents when it should say endorses, again, those are the things that no one in all of human history is ever going to think about again except you. And so we have to get over this. It has to be perfect. We want to capture the information accurately, but if it puts it in a different order, if it spells something differently than you would spell it, if it uses endorses instead of reports, we just have to get over that perfectionist quality that helped us to get to where we are, because it is not serving us any. And so I don't care which one you try. Open Evidence is free and you can launch it with your Open Evidence account. All of the other ones are great as well. They all have their pluses and minuses. None are perfect, none are awful. They'll all do what you need to do, which is accurately capture the information, put it into a succinct note that you can then put into your EMR to quickly document the information that you need to. The other thing that trips people up is, well, are patients okay with being recorded, and do I need to get consent? We get consent. We get consent when they come in for a visit or when they join the practice. We have their member forms that include ambient AI scribing tool. No one has ever said boo about it. And we let people know, oh, I'm just gonna have my computer on capturing this. Are you okay with that? No one cares about that. They expect that sort of thing. It helps me to be able to be more present for them, and nobody is bothered by that at all. But it is good to get consent, to just let them know, hey, this is being recorded, but that is not a reason to not do it. What will happen when you do this is that you will have so much time back. You will be able to think deeper about your patients. I'm able to think deeply because I'm not trying to document every little thing. I know that it's catching the things that are important, and I know that it's not, and it's going to catch things that I would otherwise probably forget if I was trying to document after the fact. But what it will do for you is it will help you think more deeply. It'll help you look at your patient in the eye more and be more present and help them feel understood and taken care of. And it will give you time back, time to spend with your family, time to spend learning and growing in your craft, time to sleep. All of those different things come back to you from an AI scribe, which is totally free now. You don't have to go interview somebody from a college kid. You don't have to get them to the office. You don't have to get them their own computer and their own computer on wheels and explain to people why and pay them all the different things that went into building the scribe program when I was doing that almost a decade ago now. All of those things are wrapped up in your computer without any additional cost. So if you're using a scribe, share on this post. If you click through, share how it's working for you and what it's doing for you, what the hiccups were. And if you're not, explain to me why you are not using a scribe in 2026, in 2027, because I want to know and understand what's stopping you from doing that, because I haven't thought of a good reason why anybody shouldn't have a scribe on a regular basis. Now, after the music, we're going to do a quick question about standing out in your community, and then we will wrap things up for today. Okay, one thing we know about private practices is we run lean on purpose. We avoid all the bloat, we avoid the extra staff, and when we want to elevate care, we focus on empowering and elevating our team. Your staff waste a lot of time on the phones each day, answering the same questions, passing along the same messages, people calling to cancel their appointment or to ask which insurance you take, those sorts of things. Now, I don't believe that AI anytime soon is going to actually replace clinicians, but we can use AI to improve the experience of our staff and standardize those incoming calls. Practice, spelled Practos, is an AI receptionist for your practice. Ours, whose name is Cami, routes calls to the appropriate staff member without having to push 1 or push 2 or listen for the beep or those sorts of things, takes quick messages and passes them along to our team, answers those basic questions, and most importantly, keeps our small team's focus exactly where it should be without the constant phone calls, the multitasking, the task switching. So if you are saying, I want to use AI in a responsible way, one place to start is an AI receptionist. This doesn't replace employees, but it allows your employees to focus on what really matters by putting a layer between you and those incoming calls to take the easy ones off the list and transfer people exactly where they need to go. Check out GetPractice, GetPractos.com to learn more. Okay, in our last section today, we're going to do questions and answers. I love and prefer just answering questions that people have. And so if you have a question, in the show notes, you'll find a spot. It's a little link that you can click to ask your question. The question today comes in from a friend. Hey, Phil, we have a bunch of local, I'm going to use the word nut jobs because the word that they used isn't appropriate for on the air if you're listening in your car or there could be kids around. We have a bunch of local nut jobs in our community, and I want to be out there providing good information, but I find it hard to get over the analysis paralysis and the fear of the comments, and I'm unsure where to start to reach our local community. This is such a good question, and this comes up all the time. There is so much information out there. There is so much misinformation and disinformation out there that it feels like, wow, if I could only share this with the people that need to hear it, one, I could probably put some good vibes out into our community when it comes to the health of our community, but also it might help me to grow my practice if I was able to get in front of them and share those sorts of things. Now, it feels overwhelming to say, okay, I'm going to start doing social media, or I'm going to start connecting with other healthcare people in the community, or I'm going to start putting on groups or something along those lines. That feels really overwhelming in the midst of private practice. And so when I talk with practice owners about marketing, I say, pick one area and one specific medium that you're going to show up on. And when I say mediums, I mean less like video, audio, those sorts of things. I think of online, I think of referrals, and I think of community events and connections. So those are kind of the mediums. And then I would pick one specific thing that you want to talk about. I'm a pediatrician. I can talk about new babies. I could talk about acne. I could talk about depression. I could talk about asthma. I could talk about ADHD, million different things. I am going to, here's all the different things that I can do, and here's all the different things that I know stuff about, and here's all the different people that I can treat. I'm going to pick one specific category and condition or age group or thing that I like to do from that and really focus in there, because the people that need to hear from you are hearing in great depth. They are listening to podcasts, they're watching YouTubes, they're reading Substacks, they're seeing all the stuff on social media about one specific issue, and they are deep diving into it. And so instead of being broad and general, you're going to get hyper specific and hyper focused and focus on one specific area for a period of time. So let's say I'm going to do ADHD. Now, I could show up and start doing more Instagram or TikTok or something like that about the nutritional aspects of ADHD, what to eat, what to avoid, what to make sure is in your kid's breakfast, those sorts of things. I could also start looking for community connections with ADHD. Well, I know a lot of kids with I know a lot of kids that have dyslexia or sleep or speech trouble also have ADHD. I'm going to reach out to speech language pathologists and say, hey, here's my approach for ADHD. I bet you have some patients that have ADHD, and I would love to help them if you find it useful to have a pediatrician kind of partnered to know about that. Or I could start going to community events and saying, hey, where in my community are parents of kids with ADHD showing up? Well, they're probably at the Parent-Teacher Association meetings. They're probably at school. They're probably in daycares or those sorts of things. Maybe I can get in front of one of those community groups and talk about ADHD there. So there's 3 different places. Then I can pick one of those and really focus in there. I really want to connect with other clinicians and share with them about ADHD. Okay, so I'm going to do that. I'm not going to get on Instagram. I'm not going to start having group education meetings. I'm just going to focus on one specific area, and that area is going to be getting in front of other clinicians that take care of patients with ADHD. And the way that you're going to do that then is you're going to find out from your own patients who they see on a regular basis. Maybe they have an occupational therapist, maybe they have a speech therapist, maybe they have a reading coach or something along those lines. There's lots of different places that they interact, and go to them and say, hey, what are you seeing in kids with ADHD right now? What are you finding are the real big difficulties that they're facing? If you start that conversation from what are you, fellow healthcare colleague, seeing right now, then they'll tell you all the things that they're seeing. And then you can say, hey, some of these ways I might be able to partner with you. You have a lot of kids that have poor sleep, are really restless, have picky diets, and have ADHD. And you're helping them, occupational therapists, to work on regulation and executive function. Here's where I might be able to help you, is making sure that their iron levels are okay, or making sure that they're getting good sleep, and if not, getting them a sleep study or something along those lines. So if you have patients that are in need, let me know, and I can sure help you to get them the resources that they need. That is a way to get out into your community and to start making a difference. And when you have a patient that comes in and says, hey, our occupational therapist said that you could help us get a sleep study and some iron levels done, and then they get those results back, or they tell a friend, hey, Jimmy just had a sleep study done and he's got some obstructive sleep apnea and his ferritin was 7, and here's what we're doing. They're going to say, well, who did that for you? And that is a way to get in your community more local presence growing. Now you can do the other ones. You can get on community groups. You can get on social media and those sorts of things. I would pick whichever one feels like the path of least resistance to you and the one you're most excited about, and start there, because taking on some of these, as they call them, local nut jobs, or a different word that they use, you're going to do that one little piece at a time. You're not going to be able to eat the elephant all at once, but you're going to eat it one bite at a time. And that's the way that I would do it. Now, hopefully this episode has been helpful for you. I would love to hear, drop in the comments your thoughts on this episode, your questions, what you're seeing in private practice right now, what's helping you to keep going, what's keeping you up at night. I would love to hear and carry on the conversation. Until next time, keep up the good work.